ASH advocates for hematologists by bringing important issues to the attention of the U.S. Congress. Here's a look at how the ASH Grassroots Network is helping you and your patients.
We had more than 200 visits in this past year advocating for two things very clearly: sustained and increased funding for the National Institutes of Health to support the research enterprise that is the source of biomedical advances, and to advocate for sickle cell disease so we can bring this orphan disease to the attention of our representatives and senators and make sure that we have the resources that we need to best treat our patients.
This year, ASH launched the Congressional Fellowship Program to connect hematologists to the policymaking process and to educate congressional members about the issues that are important to hematologists and their patients. The first ASH Congressional Fellow, Dr. Catherine Zander, will spend a year in Washington, D.C. working on Capitol Hill.
I have a position in the Energy and Commerce Committee on the Democrat side. I work mainly with the Environment Subcommittee. We do a lot of work with EPA oversight. There are a couple of bills that we're really trying to block that would lead to a huge increase in things like blue baby syndrome. Again, with the EPA, there's a lot of trying to make sure there's regulation on a lot of these dangerous chemicals like trichloroethylene that really they're linked to non-Hodgkin lymphomas and different leukemias, that and PFOA and PFOS. We really just want to make sure that they don't end up in the drinking water or anywhere else.
This year's Grassroots Network Luncheon featured speaker Alan Wurtzel, a special advisor at NBC Universal. He discussed issues impacting the changing political and media landscapes in Washington, and also talked about how hematology advocates have a responsibility to use truth to impact public opinion and policy.
As somebody asked, we have a few minutes with each of our patients. How can we begin to foster better communication? I think one of the questions is ask them, where do they get their information from? I mean, if it's coming only from Instagram, maybe there are a couple of other places that you might be able to advise them. It's very hard because what the technology has done has been to enable people to sort of, curate their own information. And while on the one hand it's terrific, there's no longer those 3 or 4 gatekeepers. On the other hand, there's no quality control over the information they get. Some of these things don't really matter, but when it comes to things like health and medicine, they really do.
You can get involved in ASH's advocacy efforts by checking out the Advocacy Toolkit at hematology.org/advocacy.